Delaware Governor John Carney on Tuesday signed Executive Order number 25, establishing both health care spending and quality benchmarks for the state of Delaware.
Executive Order number 25 is all about cost and quality. When you think about cost, I think about affordability and sustainability. The state of Delaware provides health insurance for state employees and retirees, and it covers about half the cost of individuals on Medicaid. Together, that's about $1.6 billion of our $4.4 billion budget. And that expenditure line has been growing at a rate faster than our revenues. So fundamentally, the target that we're going to talk about, Rick will mention it, is to try to keep healthcare cost inflation, the increase in costs in healthcare, in line with the growth of the economy, which is about consistent with our revenue growth. So you're not squeezing out investments in education, in economic development, and all the other priorities that we have. This is, in my view, one of the biggest challenges that the country faces, not just the state of Delaware.
House Joint Resolution 7 started this process where we said we needed to set up recommendations around a healthcare spending benchmark and continue to think about how you would do that, what the important factors would be. We then launched into an advisory committee process through executive order that defined stakeholders around the table who could give us guidance on the methodology, the approach, the right data points, what populations should be defined, and that advisory committee provided recommendations around a cross section of issues, but particularly really focused on how do you do this in a way that is helpful to accelerate conversation and allow people to continue to innovate and think creatively around solutions. Those targets in quality are really focused in three main buckets. One is an indicator of primary care infrastructure through looking at a preventable emergency room utilization. That's really important because we know we need primary care providers to be at the base of anything you do to move to value and improve outcomes, to think about prevention before you think about illness, and that indicator will help us figure out those connections in care. The second bucket is to address issues around the opioid crisis. How are we thinking about moving forward in terms of making progress and preventing deaths? And how do we look at things that are actionable at the provider level around prescribing patterns? The third is really critical and one that we have worked on for a decade. How do we make sure that Delawareans have better cardiovascular health? And there are a suite of measures that give an indication about how we're making sure we're focusing on prevention and wellness, whether it's through obesity prevention or smoking cessation, things that we know matter and can really create better health. I'm very thankful that DFAC is going to provide expertise as we think about looking at economic measures and growth, because we do want to be on a path where that trend line is more sustainable so that we can make the important investments in education, transportation, economic development, because those things actually matter more in terms of health and healthcare. Those social determinants of health really matter more in terms of producing a healthy population than anything we can do in the healthcare system.
The starting point for the benchmark will be actually the same benchmark that we're using for budget smoothing. As of October, that number was tracking at about 3.8%. It could vary by the time we get to December when it will be finalized. Probably won't vary a lot from that 3.8, and then it will gradually work its way down to what we expect will be 3% unless there are adjustments made by the Congressional Budget Office in their long-term productivity forecast.
I think what's important to understand is this is meant to establish a framework in which all the players within the healthcare system will work to try to work towards the quality measures while they do that with an eye on cost. That's a long way of describing what we have in here. This might be the most important executive order that I'm going to sign as governor. The positive results may not even occur in this term as governor, because this is going to take some time to take effect. It's going to take a lot of collaboration among the people in our state. But if there's a state or a place where this can get done, I think our state, where we know each other, we're familiar with all the players in the system, is a place that we can do the necessary collaboration. So with that said, I'm going to sign Executive Order number 25. Just happen to have a pen right in my top drawer here. There we go. Now we got a lot of work to do.